You may not believe it, but this heartbreaking footage depicts real cases in China. 3/4 of China's 1.4 billion people have no health insurance, including peasants, migrant workers, and others in low-income occupations, as well as many children. Why is it that so many Chinese people don't buy or can't afford health insurance? Let's first look at the official website of the Central People's Government of the People's Republic of China. An article reported, "At present, there are 1.36 billion people enrolled in China's basic health insurance program, with the rate of enrollment stabilizing at over 95%. The basic healthcare insurance system has already covered all people in the country." Is reality what the official media of the Chinese Communist Party, or CCP, says it is? The answer is no. According to Radio Free Asia, at present only 15% of Chinese people have medical and healthcare coverage, and 85% of people aren't insured. One of the reasons is that China's medical health resources are distributed unevenly. 30% of the urban population occupy 80% of the health resources, while 70% of the rural population has only 20%. That is to say, even if peasants are insured, they have no place to go, or they have to go to the hospitals in big cities in order for treatment. Secondly, although the Chinese government has implemented a basic national medical insurance system, especially the implementation of the new rural cooperative medical card in rural areas, the scope of the coverage is very small. The insurance doesn't cover some major diseases, and patients are only reimbursed for general medical expenses. Other expenses such as surgeries, checkups, equipment, and expensive medicines aren't covered. In other words, except for general medical expenses, all other expenses aren't reimbursable, and all life-saving medicines aren't usually included in the medical insurance. Patients have to bear the high cost themselves. One serious illness can easily destroy a family financially. Under these circumstances, 87% of peasants rely on their own for medical care. To them, it seems pointless to pay for insurance when they live in a tight financial situation. Some peasants said helplessly, "When the ambulance rings, a pig is lost, a year's work is gone if you are hospitalized once, and one illness wipes out decades of hard work." Moreover, since the 1990s, the CCP has implemented a healthcare reform in which all public hospitals are required to be self-sufficient financially. A pay-as-you-go healthcare system was then put in place. It has led to the cruel fact that hospitals won't treat a patient if he or she doesn't pay a deposit first. Patients are driven out of hospitals because running out of money becomes a common occurrence. Let's look at the following 3 real-life cases. A 12-year-old girl from northern China has leukemia. Doctors are preparing to give her a stem cell transplant, but it costs 300,000 yuan, or about $42,000 US. Her parents only make US $5,500 a year at most. Her father, who already owes a lot of money for her treatment, can barely find another US $42,000. He is ready to sell his kidney to save his daughter's life when he discovers a farewell letter left by his daughter. It's heartbreaking, and the father is weeping. "I don't have that much money. How can I save her? When I was looking for stuff, I found the goodbye letter she wrote me.
I want to thank my mom for taking care of me all the way. I'll video chat with you every day after I leave, so don't cry. I'm not scared. What are you scared of, right? So let's work together. Also for my dad. Don't worry about me. You must work hard to make money. I want to thank my sister. Her stem cells are a 100% match for me, but she's only 5 years old and her body is weak and tiny. I'm worried if she can handle this. I want to save my sister. I want my sister to get well soon."
The transplant cost 300,000 yuan. I don't have that much money. Han wrote in her last letter that if the transplant didn't work, then don't be too sad and let her sister be here to take care of me. What should I do? I see this kind of thing on TV. Why is it happening to us? We haven't done anything bad, and we haven't done any harm to the world. I wish I could get this disease, not my child. Why must my child suffer from this? She is only 12 years old. I told the doctor if I could save my child, I would do anything, even if it cost my life. I could go and sell my kidney. In the second case, a father has to give up treatment for his 12-year-old daughter who has leukemia because he didn't have the money. Before she was discharged from the hospital, the daughter said her last wish, which broke the father's heart. My name is Wang Honggong, and I am from a rural area. I quit school to work at 14 years old. I had 2 daughters by 2005, and my youngest one got leukemia in July this year. My family is poor, and I've been trying to make a living, but I've lost money in everything I do. The village leaders helped me raise some money to do the first chemotherapy treatment. My daughter knows that there is no way to get the treatment she needs. So she said that her only wish is to return home while she is still alive and kowtow to the people who have chipped in to help her. What she said made my heart bleed, but I have no money and no way to save her.
Hello, aunties and uncles.
The third case involves a 2-year-old boy. He was diagnosed with leukemia. After 6 treatments of chemotherapy, his condition stabilized and his mother's match was successful, but the transplant surgery required $42,000, which the mother doesn't have. The doctor wants them to be discharged from the hospital right away. Before leaving, the boy said to the nurse, "Bye, Auntie. It's so sad that people break down in tears."
Come and help Mom pack. Good job. We were supposed to transfer to this hospital for assessment, followed by the transplant right away. It was all lined up for us. But now we have no deposit, and we're told to leave today. We're leaving. We're going out to a faraway place.
Bye, Auntie.
I thank you all very much. This deposit gap is not small. I don't have any assets for collateral or auction, and it's already very difficult for me to borrow money now.
In addition to 3/4 of people who don't have health insurance, about 1/4 of China's population has a health insurance fund or personal account. These people live in the major cities and include those who work for foreign companies, owners of small businesses, current and retired employees of state-owned enterprises, and higher-paid employees and retirees of private enterprises. Are these people safe and secure? Not really. In China, the health insurance plans have narrow coverage, high out-of-pocket payments, and low maximum coverage. Many imported medicines and life-saving drugs aren't covered by the insurance. A Wuhan citizen angrily condemned China's health insurance policy.
Last night, I posted a video about health insurance reform. I don't think I said anything significant, but I was harmonized. It means there is intervention from the CCP authorities. I don't know what you guys are afraid of. You don't let us say anything. You don't let us offer feedback. You can't accept any criticism. Is that it? The public's opinions, the public's ideas, you can't take them now and find them offensive, right? Why do you think so many people are talking about medical insurance and delayed retirement? It is because you have done these things in an unreasonable manner. People don't think what you did is reasonable, so they talk about it. If most of the people agree with you, why would so many people complain about it? Why would so many people come forward and protest it? You are forcing others to criticize you for what you have done. You better think about it. During the 3 years of the epidemic, people have been living like this. Have you ever offered us a single-cent subsidy? Now that the epidemic has just passed, you just want to profit from other people's health insurance and social security. All this aside, you know in your heart what you have done. Both health insurance and social security have been increasing every year, from the earliest dozens of yuan to what is now, who knows how much. My current monthly health insurance premiums are what? Just because I'm a flexible worker. I checked my account yesterday and I was charged 447 yuan. You told us this was an outpatient co-payment. We must go to the outpatient clinic in order to have cold medicine or fever-reducing medicine reimbursed. How much do you reimburse me? It's probably less than 100 yuan. All these life-saving medicines aren't covered by medical insurance. So what exactly are you reimbursing me for? I'll ask a question now. I went to the outpatient clinic and spent 1,000 yuan. How much can you reimburse me? You think we people are stupid and we can't figure it out and we don't get it, right?
The CCP officials have a massive problem of corruption. Moreover, a large group of high-ranking officials enjoy special health care, depleting significant medical resources. The general public cannot afford to see a doctor, while many party and government officials and the privileged class have access to luxurious hospital rooms and all kinds of resort-style treatments. This kind of injustice is why the general public is not able to get basic medical and healthcare services. While 80% of the healthcare spending is claimed by 8.5 million party officials and cadres, the rest of the ordinary people can only partake in the remaining 20% of the healthcare resources. According to a report by the Academy of Social Sciences, there are 2 million party officials who are on long-term sick leave, and 400,000 of them are occupying the cadres' wards, cadres' lounges, resorts, etc. at great expense every year. Since 2006, the Statistical Yearbook of Medical and Health Authorities no longer includes the item of publicly funded medical care, and the medical expenses of public officials have been embedded in other government administrative expenses. Thus, there is no way for the public to know the exact amount of such expenses anymore. Anyone who has ever been to a Chinese hospital has seen this scene. Hospitals are overcrowded, with 10 or so inpatients crammed into a single ward, and in times of shortage, temporary beds are set up in hallways or courtyards. It's a different case for high-ranking officials or party members. Wards designated for this group have single and double rooms, spacious and comfortable, with air conditioning, refrigerators, color TVs, telephones, bathrooms, hot water supply, and other amenities, as well as a direct telephone line and internet access. Officials who have reached the high level can access these facilities to recuperate whenever they want, sick or not. Some moody leaders even stay there long term. The gravity of corruption in China's healthcare system is getting more glaring nowadays. According to mainland media China Business Network on July 30th, 2023, the incomplete statistics of a medical new media reported that at least 155 hospital presidents and clerks were investigated so far, which is more than twice as many as 2022's annual statistics. Over 39 days in 2023, at least 26 hospital leaders fell from grace or were double expelled, losing both their party membership and their jobs. They were either expelled from the Communist Party or arrested. 19 of them had served as hospital chiefs, and 7 had served as deputy chiefs. From the information published by the CCP, the fallen officials are investigated mainly for 2 reasons. First, medical corruption. Using the power on hand, these officials accepted bribes for personal postings and dismissals in hospitals, infrastructural projects, and the procurement of medical equipment and products. Second, lacking professional ethics. Officials of the medical system were found to be unscrupulous, trying to make money off surgeries and treatments for their patients. For example, on July 13, 2018, a hospital chief in Yunnan province was sentenced to life imprisonment for accepting bribes. The trial found that he accepted bribes from companies and individuals worth a total of more than RMB 116 million, or over US $16 million, for providing convenience in hospital construction, procurement of drugs and medical equipment, and personal appointments and dismissals. He accepted bribes from the boss of a real estate company that included 100 housing units and 100 parking spaces valued at more than 11 million US dollars. And from hospital employees, he accepted bribes amounting to nearly US 30,000. On several occasions, he received gifts and monetary offerings amounting to US 210,000. Another director from a Yunnan hospital accepted gifts from more than 30 businessmen worth more than RMB 30 million, or approximately US 4.15 million. He also accepted huge sums of money from dealers in the process of procuring major medical equipment for the hospital. A typical piece of equipment was a digital angiography system. The dealer obtained the machine at the price of 5.7 million yuan from the manufacturer and sold it to the hospital at a commission price of 11.7 million yuan, double the amount. In addition to hospital presidents and standing committee party secretaries taking advantage of their positions to corrupt, hospital employees ranging from department directors to regular doctors are riddled with corruption due to a lack of professional ethics. Some doctors demand red packets or money in Chinese from patients, while others treat patients for profit. They use practices like treating minor ailments with major treatments, maximizing treatment time for major ailments, prescribing more checkups, more surgeries, and more drugs in order to make more commission and more profit. This doctor is known as Dr. Devil. According to media reports, normal patients under the treatment of this doctor would become sick, and minor illnesses turned into major ones. Patients who are suitable for surgery are treated with other high-cost treatments. Emergency patients are frequently subjected to robotic surgery, being charged with high fees. Patients and their relatives are coaxed to undergo surgeries regardless if they are sick. Patients are coaxed to buy healthcare products to be used as medicines, and so on. The lack of separation between treatment and pharmaceutical sales in Chinese hospitals is yet another major cause of corruption in the industry. About 70% of pharmaceuticals in China are sold through hospitals. In the pharmaceutical industry, getting through to the relevant hospital departments and doctors with prescription rights to push their drugs is a default way of obtaining sales. Almost every pharmaceutical company, foreign or domestic, will do this. Pharmaceutical companies will offer financial rewards to doctors for recommending or prescribing specific drugs. It results in doctors prescribing certain drugs more often. Prescriptions aren't given out based on the patient's actual needs. Some doctors or medical institutions work directly with drug manufacturers and form so-called pharma partnerships. They receive a portion of the revenue from the sale of drugs. Selling more drugs to patients who don't need them in order to make money is a phenomenon that poses health threats to patients, as well as additional financial burdens.